Our next two presenters, I also have a little bit biased for. Will Gomez is a clinic coordinator at Astia Health's Abbotsford clinic, and Jessica Vidal is a registered nurse at our Abbotsford clinic. And the reason they are presenting is they are both bilingual in Spanish. And you know a little bit thing about Abbotsford, you know that there's a large Spanish-speaking population, large part due to a employer there, Abbyland, who employs many of those people. And there is a lot of barriers to healthcare in our country, and that's for those of us who speak English as a primary language. Now imagine if English wasn't your primary language, or if you didn't speak English at all, trying to navigate the healthcare system in Wisconsin, in America. It's no surprise that a lot of people just give up. They don't go to the doctor. If they do have to go receive medical treatment, they're going to high-cost services like the emergency room for what should be just primary routine care, and costs skyrocket, and medical debt explodes for these folks who don't have a lot of money to begin with, and for the employers who help sponsor that plan. So when we spoke with Abbyland and they became a client of ours in conjunction with their benefits consultant, Ansay, they took a risk and said that these barriers can be broken down and our folks can receive high-value, low-cost health care just like everybody else can. And the next two presenters, Will and Jesse, are really key for us in helping to break down those barriers, and they're the ones that are on the front lines every day breaking down those barriers for those patients of ours that either speak English as a second language or don't speak English at all, and they do a great job of it. And so they're going to kind of talk about what some of those barriers are, how they accept those challenges, how they break down and how they overcome those challenges, and how they're working with that population to improve their health care, improve their lives, and also help out Abbyland in the process as well. So Will, Jesse, if you guys want to come up.
So as we were introduced, Jesse is our bilingual nurse at Astia, and I'm besides that coordinator, an interpreter for the clinic. And Jesse, did you want to say anything?
You still need to speak. Sorry, Will. You still need to speak into the microphone. This is just for the video recording.
Oh, I apologize. Okay. All right.
There you go.
Can I take? Do you want to say anything? No? Okay. All right. So hopefully you heard what I said. So I have there's a difference between Jessie and I besides gender. She is a shy person. That's not the difference. We're the same in that because we're both very shy in front of crowds. However, I'm a good faker. She decided not to fake it today, so she chose not to speak. But she is very very open with our patients when it comes to that. So she's going to be managing the clicking, right? Yep. All right, thank you. So I wanted to tell you who we are. So that we is just means Jesse and I. I'm not talking about a whole Astia. So what I've learned from Jessie is that she had experience working for other healthcare facilities, and it's very much what Tracy already said and others have said, that she came to Astia because what she was attracted to and still enjoys is that the personal care that she's able to give to our patients, specifically the Hispanic patients. However, she does serve everyone. Doesn't matter what language they speak. And the reason I came to Astia, I was not looking for a job at the time, but Lisa contacted me, and I'll tell you something. That was the first interview that I was not shaking in my boots, sweating profusely, because when we got done speaking, I thought it was just that. We were just chatting. We were just speaking on the phone with her and Justin. Come to find out, we had another chat, and then they're offering me a job. And I said, wait, when will the interview be, or when was it? We already had it. And so that's their approach. That exemplifies their approach. It's not that they didn't ask good questions, it's that I didn't notice there were questions. It was just a mutual sharing that we did, and that told me right away that they were non-traditional. They didn't have a set of questions that I had nightmares about answering the night before. So we love working with our patients and with Astia. As you well know, there are social determinants of health, and I'm not going to explain all of this. Oh, by the way, I have some bad news for you. I have 28 slides. And I only have 15 minutes, right? The good news is that I'm supposed to spend about 33 seconds per slide. And the other good news is that after this, there's lunch, so then you have something good to look forward to. You already know that education, access to education, good quality education, economic stability, and other things affect health. We know that very well. When the working and living conditions for our patients are very different, and not only different, but challenging for them, and when their access to quality health care is limited, and we have what is called health inequalities for our patients. Next, thank you. It means that their ethnicity and their culture, it gives them a great barrier, as Justin already said. Their reading literacy, and by that, as you know, it means ability to read and write in their own language, not only in the second language, in this case Spanish in most cases. I shouldn't say limited, but it's challenging for many of them, especially if they're older adults from the Hispanic country that didn't have the opportunity to finish schooling. So that reading in their own language and writing in their own language is difficult, let alone a second language. The health literacy is a challenge for them, obviously. Socioeconomics. All these things influence how our Hispanic patients perceive their own symptoms. And perceive the conditions that they're in. It influences how and when they will seek care, their expectations of that care, and their preferences for the procedures that might be offered to them. So this creates a great challenge not only to them but to us, specifically the nurses, medical assistants, and the healthcare providers, to know how to best provide a good quality healthcare for them. Are there any tools available? Cultural competence, and very obviously, it's not just cultural awareness. I think we all are aware that there's cultural differences and there's different cultures and behaviors, but competence, it's a much higher level than just awareness. Before we talk about what cultural competence can do for us, I'm talking about right now about without it. Without it, just like the confused patient and provider they're both are unable to see the differences, and specifically we are unable to see the difference between us and our patients, and therefore we are in danger of delivering a lower quality care. Without it. With cultural competence, we're able to deliver effective quality care to our patients because they come in with very different values and behaviors. And providers can personalize their care, and that's again one of the reasons why our providers are with us. And Christine, I wish so much that she was here. Christine Gravine, our medical provider at Abbotsford, because her and Jesse really have a heart desire to personalize their care according to the culture and the differences of our patients. With cultural competence, we can understand possible impact when our differences get in the way of delivery of the care. Now, it's simply understanding that there are is simply understanding a culture as we think, let's just say, like, you want to think about the Hispanic culture or the the Asian cultures. It's just understanding their culture. Is that sufficient for predicting that patient's behavior and attitude? Like, for example, I know how all Hispanics think. Therefore, I know how my patient Maria will react when I tell her this. And I understand how patient Jose is going to react. The answer is no, because people are unique within the same culture. And their behavior and beliefs sometimes are slightly or quite different from their own culture. So just understanding a culture is insufficient. So what is needed? What do we need at Astia and Abbotsford? Cultural humility. It means that we recognize that we have limits. We may have lived in Mexico for 10 years. We may have friends from Costa Rica that are our neighbors. We may have traveled here and there and understand and read a lot about a culture. We still have limits, and that's one thing that Astia in Abbotsford we recognize, that we don't just assume that we understand every patient's culture. And then we try to acknowledge that we may have biases that are unintentional, unconscious. We think that, hey, I accept people of all faiths, all cultures, all backgrounds. But in many cases, we have biases that are not showing up yet, but they will show up eventually. So cultural humility for us has been going through self-evaluation. How are we doing? How hard am I trying? Is there anything I'm missing about understanding our Hispanic population? We explore and reflect about our own beliefs and our behaviors, which leads to openness and curiosity. When we get asked questions like to Jesse and I, or Jesse, do you have any background on why is this patient reacting this way, or why they're not telling me as much as I would like them to tell me? We can offer insights into that. And so that what we want to do is provide culturally and linguistically appropriate services, CLAS or CLAS. When we provide our services that are culturally and linguistically appropriate, it breaks down barriers, these barriers that our patients have. We've seen that improving on the trust and the respect that they have for us. And the patient engagement and participation it improves. It's better. When we provide services that are appropriate and culturally and linguistically, it improves our understanding, the understanding between the patients and the healthcare providers. For example, one thing that our medical provider, Christine, is very emphatic about is when patients come in with children that might be more bilingually skillful than their parents, she really discourages interpreting by the child. Even if one of us is busy doing something, her first priority is to not use the child. Why? Because there are things that in the information collection process will not be shared in front of a child, to a child, or sometimes to a spouse or a partner in the same room. And so she's very careful in that she wants to get the best information about this patients. Then the dialogues become active from the healthcare provider to the patient and the patient to the healthcare provider, and increases compliance. And we all know what that means, that they will follow medical advice. When we provide services that are appropriate linguistically and culturally, it increases patient safety, improves the health outcomes, decreases health disparities that you've heard about, and you probably know more than I am saying right now. It reaches goals, what is the goal? Improving health for all patients. It improves their satisfaction, the patient satisfaction. it reduces our inefficiencies, having to redo things, re-explain things, make new appointments to go over the same thing. Now, I'm not saying that we never make those appointments, but it reduces the time because it was better explained, better shared, questions were better answered the first time around, and decreases cost, which others cover that very well. So now we want to talk about, so how is Astia? All that was good. That's theory. How is Astia, how Abbotsford Clinic applying this cultural competence? So I have a few examples. And this is the beginning. We try to gauge how we're performing currently, where are we falling short in providing language accessibility. And I tell you what, it's not a matter of just we're just throwing an interpreter. Okay, so we're not gonna have the children interpreted anymore, or the spouses or the partners. We're just gonna throw in an interpreter in the clinic. Is that enough? We'll see why not. Where do care disparities exist within our system? We try to, and by our system I just mean in our clinic, for example, we try to see where we are not underperforming. One thing that Astia leadership has done is recruiting and retaining diverse team members. And it's not just about speaking the language, which is what I was referring to, is that we share the culture. While you can tell from my accent that I went from a different culture, Hispanic culture. I was born and raised in Mexico. Now, is that always necessary? In Jessie's case, she was not born in another country. She was born in Wisconsin, I believe. However, she's been immersed in the culture through marriage, through friendships, through interactions with the community. So she shares the culture of our patients. And we staff, we try to share our insights with our colleagues, and they look to us for advice. Astia is investing in developing infrastructure. That means that our materials are linguistically diverse, and by that I mean available materials that we can find sometimes online from our providers of literature and brochures. We constantly ask them, do you have that in Spanish? And I don't know why. They typically say, yes, I do, but I don't have it with me. So they're always coming back to bring it to us. Both Jesse and I are bilingually and biculturally proficient in the Mexican and Central American Spanish, which, by the way, differs a lot from Spaniard Spanish. I once, someone told me once, well, I speak Spanish, I spent 2 years in Spain. That person could not understand the Mexican Spanish and Central American, and they could not understand that person. So I'm not saying which one, I'm not raising the bar, one above the other. It's just that that's the case. Obviously, Astia is trying to recruit diverse staff. I don't know if any of you thought, okay, so if you both are here today, who's helping at the clinic? Nobody. No, just kidding. We do have a PRN staff, bilingual staff that comes when we're unavailable. So that's part of the recruitment. Our signage. Unfortunately, at the beginning, all signage was in English, and we've been translating or obtaining signage in Spanish. Any health information that we display or we give away, we try to have it in Spanish. One thing, and I didn't think about this, I'm not going to take credit. The prescription labels are provided through questions of patients and how, if they were complying with the time and the dosage. Well, she found out that the pharmacies where patients get their medications often do not provide an interpreter for them, nor are the instructions given in Spanish. So she makes sure, she asks one of us to make sure that she sends, right from the second she's sending the prescription to those pharmacies, it's in Spanish and in English. That has been a great help for them and in compliance too. And this, Jessie should get the credit for it because it came from her. she has established, oh, by the way, modifying or adapting new services in Spanish. She started demonstrations of using equipment because a lot of times patients do not ask the questions of how to do it, how to use equipment, even though it might be described verbally. And so she recognized that demonstrating with them right at the appointment times, it improves understanding and usability. And okay, so another one that Jessie came up with was she had a burning desire to begin to provide certain medications that are frequently used and the equipment that is frequently needed by the patients. And she came up with a program to provide it right there at the clinic. And I'm tasked with translating instructions that are not currently available elsewhere. Let's see, the next one, promoting self-care and interest. Okay, so how do we promote self-care and interest in the patients for their own health? Astia, and this is not something that I came up with, Astia leadership came up with providing on-site biometric sessions, taking vitals on certain days, labs, and the follow-up appointments to talk about those results. That has increased their understanding and interest in their own health. We as a staff share with our colleagues, for example, and these are just examples, I'll skip to the next sentence here, that when a patient says sí or yes, it does not always mean that they agree, that they understood, or that they intend to comply. It just means, I heard you. That's what it means. And again, and I'm doing it broadly, this is one of the things that I need to remind myself, that not everyone from a Hispanic background may be doing what I just said, but it tends to be quite normal. Why? Because saying no in a Hispanic culture, saying no to you, to any kind of authority, any kind of person that is in any place higher than myself, to say no to them means to challenge them, means disrespect, and means that I don't accept you. So when our medical providers do not just say, oh, do you want to do this? Yes? Okay, good. Well, let's go for it. They dig in more. They ask, do you have any questions? Let's talk about this. And how do you feel about this? Why? Because they're learning that just a verbal assent does not mean that they want to comply. Making eye contact with the authority figure, and you may be thinking, well, nurse is not an authority. Well, in the Hispanic culture, overall, any person basically that is in front of you, unless they're your peer, I mean, the cashier, the policeman, any person that is doing a service for you or with you is in some sort of authority. And to make eye contact with them is considered disrespectful. Now, not everyone adheres to that practice, but that is one of the differences. And so it's not, in the American culture, not making eye contact can signify uninterest, distraction, but not in the Hispanic culture. And seeking help from a health care provider is primarily when one is sick. In other words, I have had, I didn't mention this, but I've worked with Hispanics over 20-some years, and when I would go to, prior Astia, when I would attend a medical visit with them, it was usually an urgent visit. Why? Because they've had these symptoms for months, for years, and they didn't have time. They didn't think they could. So I kind of went on a tangent. So one is when they have symptoms and they put it off, right? Other one, specifically this one, is they typically do not think that coming to our clinic or going to a doctor is for when you're healthy and how to get healthy, how to stay healthy. It's more, come and fix me, or I came for you to fix me. How do I do that? So we are trying to change that to see us more as partners to help them get healthy and stay healthy. And with that, I'm done. I think I'm on time. Thank you.